going to move to the next talk, so without losing much time. As you have seen, we focus on the treatment of the physical disease to provide benefits to patients, but we also worry about their mental wealth, and that's the role of Dr. Hillman Ormond, who directs the Center for Counseling and Cancer Support, helping patients coping with cancer, which has been pretty difficult over the past year, as you know, we have been hit pretty badly with COVID. So, Hélène, it's up to you.
Hello, just wanted to introduce myself. I'm Ellen Ormond, and I have had the pleasure of working at the Hillman Cancer Center since 1988, which is a year after it started. Dr. Kirkwood preceded me and was one of the very, very first people in the Hillman Cancer Center. And I want to say that what has been amazing, besides the joy of working with patients and my medical colleagues and research colleagues, is seeing the incredible changes that have occurred in these more than 30 years. I think the research that you've seen has showed the really dramatic advances that have occurred in treatment. I have patients with metastatic melanoma alive well over a decade from their time of diagnosis. So it's amazing to see. And the other incredible advances have been in improving quality of life, active palliative care services, which help deal with quality of life from the time of diagnosis to the end of life. I think we've gotten very good at thinking through these issues, and the wonderful integrative oncology services that we have at Hillman, as well as across the country. These services are available. I think there are probably some people watching from outside of Pittsburgh. So these have been phenomenal advances that have occurred over the years. So I'm going to talk about cancer, coping, and COVID is the title of my talk. And let's see if I can advance the slides. And for some reason, got it. Okay. So when we initially planned this, 4+ months ago, and I suggested this title, we were in the middle of an incredible amount of uncertainty about COVID. So as in the last month or two, I think there is hope that this pandemic is resolving. Certainly we can begin to have ideas of how the end will be. My guess is all of you are experiencing a deep sense of relief. I think having cancer and dealing with the isolation of COVID has been absolutely extraordinary, with the loss of both the support from family and friends, just the comfort, and the enormous changes when you come in for treatment or meet with your doctors. But I think one of the things that's different with this cancer, coping, and COVID now is that melanoma hasn't stopped. Your particular situation is taking the course it was taking with or without COVID. And one of the things that I remember asking a patient after 9/11 occurred, and I have had patients say the same thing about the COVID pandemic. I said to her about 9/11, is this making your anxiety worse, dealing with cancer? And now we have this traumatic national event. And she said, no, it is not making it worse at all. Her statement was, welcome to my world. I think, and patients have said that about melanoma about the current COVID pandemic, that there was a sense of community. We were all going through some similar things. So I think there's this shift now as the world moves on from COVID, and you are all still living with melanoma. So what I'm going to focus on today is 3 specific topics that relate to both COVID, our experiences with COVID, as well as dealing with melanoma. And those are uncertainty, hope, and meaning. And then I just wanted to start with this New Yorker cartoon, which came out a couple of months ago. And it's my favorite cartoon of the pandemic, and also maybe my favorite coping cartoon. So I can tell you through much of this, I am that child on the floor. And I love the parents who are really realizing, you know what, this is pretty tough, and maybe screaming every now and then is a really, really good idea. Dumping your food on the floor. I haven't done that one yet, but maybe I'll try it now that I'm looking at this slide. So I love this cartoon. The other thing that I think this cartoon illustrates, and is going to be a principle of the things that I'm talking about, is you may have heard something called both and thinking. And that's in contrast to either or thinking. So in either or thinking, it's one thing or the other. Both and means that we can think two opposing things at the same time. And you may have heard this wonderful quote. I found out it's attributed to F. Scott Fitzgerald. The test of a first-rate intelligence is the ability to hold two opposed ideas in mind at the same time and still retain the ability to function. So some examples of that, and related to the cartoon we just looked at, I can have a temper tantrum and I can love my family. I can do terrible things. I have certainly done terrible things in my life, and I can do good things. It makes me neither a bad nor a good person. I'm mostly a good person, but I have both elements in me. I can be terrified, and I can move forward bravely through each day. They're both, I think, parts of life. I can certainly say for myself through COVID, my sleep has been a mess. I've always been a great sleeper. My guess is that many of you have experienced changes which have occurred either with COVID or with your experiences with melanoma. And another example of both and thinking is that you can mourn what has been lost with COVID, lost with the diagnosis of melanoma, and at the same time appreciate what has been gained. Both of those things can occur simultaneously. So if we look, there was a recent article in The Atlantic about COVID and grief. It started actually with an interesting thing, is remember your last normal day. This was related to COVID. I frequently ask patients when they come for the first time to my office, tell me when life was last normal for you. It's interesting to think back to what was normal and then how our lives are now. And the author of this article in The Atlantic wrote something which I thought was really lovely about the COVID pandemic, and I think absolutely fits with the experience of having cancer. We've lost our belief in certainty. I think prior to major tragedies, major upheavals, we tend to live with the assumption that the world is a predictable place. If I am good and I work hard, I will be rewarded. There'll be a sense of stability, peace and calm. Good things will flow to me. And we also tend to think we can plan for a predictable future. I was really interested when I started working with cancer patients, how many conversations reference the future. And that can be the long distant future or next year. It's just built into almost everything that we think about. And I think we have lost that belief in the certainty and predictability of the world. One of my very favorite articles that came out in the pandemic, and this was actually written early in the pandemic, was called An Oncologist's Prescription for Managing Fear and Chaos in the COVID-19 Pandemic. A long title. But what was interesting about the person who wrote this, and I have the link to the article, it's a lovely, lovely article, is Dr. Flora was an oncologist and is an oncologist and a cancer patient. So this article was actually written in a medical journal to his medical colleagues, in which he reveals both of these things. He's an oncologist and a cancer patient. The question he was asking is, how do we survive in this new world? In this case, he was talking about the COVID pandemic. I think it also fits with how do we survive in the world of having cancer. So his prescription was ask cancer patients. And I'm going to read a few of the quotes from his article. So when he talks in the beginning, they were going about their normal lives when a cruel and terrifying reality intruded. They are trained in uncertainty. And I think that's absolutely true. You guys are probably, when I think about that, when you hear people complaining about the pandemic, part of you probably just wants to go, get a grip. Hey, I've been doing this for a long time here. I think another quote from the article was, cancer patients must adapt to nearly impossible situations each day with grace, courage, and indissoluble hope. Real applied hope is a powerful thing to behold. And then he says right after that, however, hope alone may not be enough. We must face grim realities. So there's the kind of vision of the lovely things in life as well as the incredibly challenging things. He also said in terms of cancer patients, they excel in stress management. They are doing it every day. And one of the things he talks about is control what you can control. But he also tells a lovely story from a patient, and this was a quote, "When there is no wind, we row." And this was a woman who'd gone through a very difficult cancer course, and she had learned that her disease was progressing. She had young children at home. And her statement was, "When there is no wind, we row." And by that was talking about being flexible and doing what has to be done when the landscape changes. And this oncologist, and I can say this for all of you who are patients. So he carried this. He said he'd heard this 10 years ago and really carried that with him. And I can tell you, you would be surprised how often your physicians and medical teams recall things you have said, and it has been helpful to them as they get through their own trials in life, or just inspiring them to do what they do. And this article is a great example of that. He also says cancer patients teach us about the importance of community, that we're more powerful together than we are on our own, and that we see our connections, strength in numbers, and need for others. And I think cancer patients are acutely aware of that. And I think this conference is a great example of the power of connection, the importance of connection, the strength and comfort that comes in numbers. So then I would just wanted to make a few comments from my experience as a psychologist in terms of coping with uncertainty, what is hope, and finding meaning. And I think those were many of the themes that were talked about by Dr. Flora. So I'm going to go over this strategy for living with uncertainty quickly. It's a little more complicated, but just wanted to give you a good idea about this. So what drives people crazy when they're in a situation of uncertainty, and let's just take a simple one of you have a scan in a month or a week. That can be one situation. There can be the long-term question, what is the outcome of my cancer? So it can be short-term, long-term. Basically, people sort of bounce back and forth between feeling like I have to assume everything's going to be okay. And the other thing is I have to think, oh my gosh, what's the worst possible thing that can happen? Actually, that going back and forth is, I think, what makes uncertainty so hard. So I always encourage people to try to land solidly in one of these two sides. It's going to be okay. Or let me think a little bit if it isn't going to be okay. So the first strategy is a great, and by the way, these two strategies, if in any of your relationships, marriages, family, friends, we tend to congregate with people who take the opposite strategy. It's kind of interesting. But the first strategy in a situation of uncertainty is to focus on the belief that all will work out. And as a sideline, if you get bad news in the future, you'll find a way to manage. But your focus is going to be on it's going to work out well. And then basically what you want to do is learn use all kind of ways to push distressing thoughts out of your mind. There are a number of techniques to do that. The second equally good strategy is to focus on the hope that all will work out well, but also, and this is the both and thinking. spend a little bit of time thinking about how you can have some peace of mind if you get bad news. Not a lot of time, but a little bit. How would you deal with that? How could you find a sense of equanimity? It doesn't mean that the bad news is okay. It just means how would I manage that? So in this way, so you focus on the hope that all will work out well, but think a little bit about what if it doesn't. And then you push all distressing thoughts out of your mind. So the basic difference in these two techniques is in the second one, you spend about 1 to 5% of your time thinking a little bit about what happens if things don't work out in the way you would like. And then I actually think the Serenity Prayer, which I'm sure all of you guys have heard about, is the secret to mental health. I struggle to practice it every single day. It's not easy, but grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. And when we're looking at uncertainty, it's what can and cannot be changed in that situation, and looking at both sides of that. So how about hope? How can one be hopeful in these situations? And I think it's important to think of hope as a multifaceted perspective on life. Certainly the biggest hope is that we hope for the outcome we desire. In the case of cancer, we hope that the cancer will be cured, or we hope that it will not recur for many, many, many years. So that's one very important kind of hope, to hope for that outcome we desire. But the second type of hope, which is important to do simultaneously, again, it's the both and thinking, is we hope that we will have success and pleasures in things that are important to us. We hope that we will we think about what we hope for with our family, with our everyday life, with our spiritual life. So it's both thinking about the outcomes we desire, as well as the many other things that are important in our lives. And in addition to this concept is to think about hope within different time frames. So the biggest hope of all is, in the case of melanoma, that I will live a long and happy life. I will die in my sleep at age 95, and that you never have to give up that hope. But also, in terms of being hopeful, is what do I hope for today? I hope I get to take a walk outside. It's beautiful for those of you who are in Pittsburgh. What do I hope for this week? I hope I get to talk to my children. What do I hope for this month, this year, and then in the distant future? So hoping within all of those time frames are important ways to be hopeful. You don't have to do one type of hope. And then looking at meaning and purpose, again, I think this getting away from both and thinking and holding opposite thoughts in your head at the same times. Hard things are happening. I'm the kid on the floor. It's very difficult. And simultaneously, what gives my life meaning in the situation I'm in now? And a way to think about that, and meaning can be meaning with a big M, it can be God, it can be the purpose of existence, but meaning is also about the little things each day. What makes my life worth living in the next few hours? And one way to do that is to spend a few minutes each day thinking about what gives your life purpose and meaning. And some ways to do that is doesn't have to be deep thinking. Really quickly, what do I care about? What comes to mind when you say that? What do I care about? Who do I want to be in this time of hardship? What am I grateful for? And again, it's important to know there are lots of things you're not grateful for. So it's the both and thinking, but what am I grateful for? Something I find helpful in times of trouble is to think about who do I admire, and how can I be like them? And another thing to ask in difficult times, what can I learn from this situation? And then the last thing in terms of meaning is finding a sense of community. And one of the interesting things we don't hear much about when we're looking at stress is everybody thinks about the fight or flight response that I'm sure you've heard about. But there's another biological response to stress, which has sometimes been called tend and befriend. Tend is taking care of other people, the people you care about. Befriend is reaching out to a community. So an important response to stress is to think about tending and befriending. And for those of us who are in Pittsburgh, Mr. Rogers' line, which is always so wonderful, look for the helpers, pay attention to the helpers, pay attention to the good people. And then in terms of moving forward, one of my favorite quotes is, courage is not the absence of fear, courage is acting even though we are afraid. So one can do both of those things together. And I send out much appreciation to all of you for all that I have learned from you and the joy of knowing the patients at Hillman. It's late, but if you have any questions, I'm happy to answer them.